Tonight, new travel restrictions are kicking in, forcing flyers to get a room.
$2,000 if it costs you about $300, a 680% profit for food that we eat. I don't think that's good.
Some people think the mandatory hotel stay is just a cash grab. Plus, big names are set to take the witness stand at the Long-Term Care Commission this week. With thousands dead, advocates are looking for someone to take responsibility. And
it's not just about dignity, it's about their right. People have a right to safe housing.
we get a look inside a hotel converted into a temporary home for the homeless.
This is CBC Late Night News.
Good evening, I'm Marivel Tarouk. In just about an hour, several changes begin for passengers flying into Canada. Mandatory testing begins at airports for international arrivals, and everyone must quarantine at a hotel approved by the federal government and foot the bill themselves. But some passengers flying to Canada are struggling to secure rooms. Farah Morali went up to Pearson to check it out.
At Canada's biggest airport, passengers stream through the international arrivals gate hours before new quarantine rules come into effect.
The crew member just told me it was the busiest day in last few weeks. I mean today and yesterday because of this is the last weekend.
Many, like Vihan Bhavsar, booked or changed their flight to come back early.
Of course, convenient to come today and not tomorrow because 3 days in a hotel isn't really great.
I purposely changed the flight to come back a day earlier to make it before midnight tonight.
Starting tomorrow, everyone returning to Canada from non-essential trips must pay to stay at a designated hotel to quarantine for 3 days. The government originally said the cost would be $2,000, but hotels CBC News contacted gave lower estimates.
Some of the nightly stays are less expensive than was originally thought. That's great. The idea is that the hotels can determine the cost themselves with the individual travelers.
Well, now it's been 42 minutes.
But for some trying to get home, cost isn't the issue. It's actually getting through to the government line to book the hotels, since you can't book online.
I've been trying since yesterday, got disconnected twice out of 3 times. Been waiting 2 hours and a half, and over 2 hours and a half actually, and got disconnected.
They put you on hold. It's been 3 hours now. I'm willing to take the 3-day quarantine at these hotels, but we need access to do it.
Also starting tomorrow, mandatory testing for passengers arriving in Vancouver, Calgary, and Montreal. That's already at Pearson.
Well, listen, you have to do whatever you can to protect everybody.
The federal government said the new rules aren't set in stone and could still change if needed.
For those crossing back into Canada by land, they won't have to follow the mandatory hotel quarantine rules, but they will have to follow new testing rules that come into place starting tomorrow. And those rules are this: in addition to having proof of a recent negative result from a COVID-19 test, they'll have to be tested again at the crossing. The rules also say that towards the end of their quarantine period, they'll have to be tested a 3rd time. And while they can quarantine at home, the government is stepping up the rules when it comes to testing for those individuals. Farah Morali, CBC News, Toronto.
The province reported 1,087 new cases of COVID-19 today. There are also now more than 400 cases of variants of concern in Ontario. A GTA critical care physician is speaking out about those numbers. He told Rosemary Barton Live, "We're reopening too quickly, and without containing the variants, we could be headed towards a 3rd wave."
It's probably short-sighted to reopen for a temporary sort of reprieve for businesses to reopen, only to realize that these variants are going to explode in our population if we reopen, and we'll be back to lockdown. So I don't really believe that it helps businesses to give them a short period of reopening only to close them for longer because we open the door to the new variants.
Across the province, there are 391 cases of the variant first detected in the United Kingdom. There are 9 cases of the variant first identified in South Africa and 1 case of the variant first located in Brazil. Breaking it down by region, Toronto reported 344 new COVID-19 cases generally today, with 156 in Peel and 77 in Ottawa. The province also reported 13 new deaths, bringing the total number of COVID-19 related fatalities in Ontario to about 6,800 since the pandemic began. York Region saw 122 cases of COVID-19 today as the area prepares to move out of lockdown tomorrow. The region is the latest to return to the province's color-coded framework. They'll be in the red control level as of 12:01 a.m., meaning strictest measures will still be in place. Only a few regions are still under the stay-at-home order, including North Bay Parry Sound. The area reported 3 new cases today, but concern remains about the spread of variants in the community.
Unfortunately, due to international travel, we had VOC, variant of concern, arrive at our doorstep, and it kind of went through an apartment building. Our citizens were doing everything they could, and when you're the lowest in the province, and then unfortunately something happens, it just shows how fast VOC can spread.
Toronto and Peel are the other 2 regions still under the stay-at-home order. That won't change until at least March 8th. The province's key health officials will appear before an independent commission this week, looking into Ontario's handling of the pandemic in long-term care homes. Thousands of residents have died, and 130 facilities are currently battling COVID-19 outbreaks. Dahlia Ashry has more on what to expect.
Public Health Ontario has reported nearly 4,000 people have died in long-term care homes since January last year. Starting tomorrow, some of the province's top medical officials will be interviewed by Ontario's Long-Term Care COVID-19 Commission.
This is a long overdue opportunity for people to ask real questions about what was happening behind those closed doors.
Seniors advocate Laura Tamlin-Watts is among many looking for transparency and accountability. The commission will be interviewing Ontario's Chief Medical Officer, Dr. David Williams, on Monday, followed by Health Minister Christine Elliott and Long-Term Care Minister Dr. Marilee Fullerton. The commission has already released 2 interim reports.
Hiring dedicated infection prevention and control practitioners in each home, really strengthening the leadership within the homes. These are the sorts of things that were recommended months ago in terms of the 2 interim recommendations, but I have not seen a lot of movement towards those being realized.
Kathy Parks' father died last year at a Pickering long-term care home. She's struggling to remain hopeful.
I don't have a lot of faith in how much truth we'll get.
She's been going through commission meeting transcripts and says she's spotted some red flags, like this one from February 3rd. Commission counsel John Callaghan asks, so they didn't follow through with educating their staff on infection prevention and control requirements? A nurse inspector with the Long-Term Care Ministry responds, right.
And I would love to hear the Minister of Long-Term Care come out and say, I wasn't prepared. We were not prepared. We didn't do things the way that we could have and the way that we should have.
In a statement, the ministry says is looking forward to receiving, quote, timely recommendations that could support our ongoing pandemic response and address systemic challenges in the sector. Some medical experts say seniors have been neglected.
Now is the time to fix this broken system, to overhaul the system once and for all. Seniors deserve more than a shot in the arm.
The commission will make transcripts of the interviews available online and expects to submit its final report on April 30th. Dahlia Ashry, CBC News, Toronto.
Canada's Intergovernmental Affairs Minister says he's confident the provinces are ready for a dramatic increase in COVID-19 vaccine shipments. Speaking on CBC's Rosemary Barton Live today, Dominic LeBlanc said preparation for transporting vaccines from airports to clinics has been underway for some time.
There has been an ongoing, highly visible series of rehearsals, of tabletop exercises, General Fortin with his counterparts in every province.
Over 640,000 doses of the Moderna and Pfizer vaccines are expected this week. On Friday, Justin Trudeau said hundreds of thousands more will be arriving each week after that. And Mississauga is getting ready for the influx of vaccines. Mayor Bonnie Crombie tweeted a picture of a new vaccine facility in her city. It's at the Paramount Fun Food Center and is expected to open soon. 600 people an hour can be vaccinated there when the center is running at full capacity. Well, today was a break from the storms that hit us this week, and residents around Greenwood Park knew exactly what to do. Skating against a beautiful sunset and a lot of snow, pulling out those sunglasses and snow pants and fooling around with the kids and enjoying winter while maintaining physical distance. Now that is a Sunday well spent. And thank goodness, Sophia, that we had a beautiful sunny day today, because it looks like things are going to get messy.
You know what, though? We are a hardy folk. We have had a lot of snow in the last week or two. This next system, more like salt in the wounds, if you ask me.
Oh, boy.
The snowpack is substantial, and it's only going to continue to grow over the next little while. Weather advisory out from Environment Canada for what could be sort of a dicey Monday morning commute. We're talking the possibility of 5 to 10 centimeters of snow, the heaviest of which will come down when many of you maybe have some plans on the roadways for Monday morning. It's a Colorado low. It will be lesser around that QEW line and for Niagara region. Inland sections, kind of Brampton, Milton, and north, you're looking at that 5 to 10 centimeters. And then a second system comes in, a clipper, more of a wind and snow event for Tuesday. That's why all in all, combined with the two systems, you're looking at that 5 to 10 centimeters. It really kind of sets the scene for what will be an unsettled rest of the work week. But here is the thing, folks. Both of these systems are tracking farther to the north, which means you'll have some milder pushes of air. It'll feel downright balmy, really. 3 degrees, a few degrees above freezing and above the seasonal mark. So it'll be quite nice, but it really will kind of whet the appetite for what will be a few days of waves of snow to come, and maybe even a storm into the long-range forecast. We'll talk about that in a few minutes.
Okay, we'll see you then. Thanks, Sophia. Toronto police are investigating after several people allegedly threw bottles from a downtown condo onto the street this afternoon. The area near York Street and Lakeshore Boulevard was closed for a few hours today while officers investigated and cleaned up the road. They were called to the scene around 2:30. Police said they narrowly missed being hit themselves by the thrown bottles. The area was busy as well because of a grocery store at the base of the building. When officers went into the condo on the 35th floor, they found 14 people gathered together. 4 now face criminal charges. All 14 were fined for gathering. And Toronto police are asking the public for help in a homicide investigation. Officers heard gunshots on February 12th while they were patrolling the area near Martin Grove Road and the Westway. They found 28-year-old Paul Dunkley shortly after. He suffered a life-threatening gunshot wound and was transferred to hospital, where he later died. It is the city's 11th homicide of the year. 2 new shelters open in Toronto tomorrow, part of the city's plan to tackle homelessness during the pandemic. Growing numbers of people are leaving shelters for fear of contracting COVID-19. Last Wednesday, a wooden structure caught fire at a homeless encampment just east of the downtown, and 1 man was killed. Jessica Ng gives us an inside look at one of the new COVID-safe spaces opening up.
The finishing touches are being made to 45 the Esplanade, turning this downtown hotel into a supportive shelter.
It's an absolute game changer for people. In order to have access, we know that the systems are not built around the needs of those who have really difficult, challenging lives on the streets or in the shelter system.
Dr. Andrew Bond heads up the team that will be delivering care to residents of the repurposed space.
We have a fairly robust complement of services that ranges from 5 days a week on-site nurse practitioners with nurses, as well as primary care physicians, substance use care physicians, consulting psychiatrists.
It's all part of the city's new housing strategy.
We're going to have a pharmacy here every day of the week, Monday to Sunday in the mornings, which is going to be great. We're going to have a harm reduction team, hopefully every day as well.
Homes First Society is in charge of operating the facility, which aims to accept up to 10 clients on day 1, increasing to a capacity of over 200. The other shelter space opening Monday is St. Simon's Clubhouse in the building behind me on Sherburne Street. It will house up to 36 male and male identified clients during a year-long lease. Municipal shelter data says nearly 4 of every 10 clients from encampments have never used a city shelter before. Councillor Joe Cressy says he hopes the new facilities can change that.
Especially with new, more transmissible variants spreading, we need to ensure that our shelter system doesn't just provide a safe place to sleep, but provides safe physical distancing.
As of Saturday, there have been 158 outbreaks at congregate living settings in the city, and cases of COVID-19 variants are increasing in shelters specifically. Bond would like to see this vulnerable population get vaccine priority.
From a straight public health standpoint, everybody has an interest in seeing people experiencing homelessness be vaccinated, both to protect them as vulnerable individuals, but also to protect them from the spread of outbreaks across the shelter system as well into the wider communities.
Collectively, the Esplanade and St. Simon's will add over 240 beds to address homelessness in the city. Jessica Ng, CBC News, Toronto.
Stunning when you look at the numbers, almost unbelievable, but it's true. This is a devastating pandemic.
The U.S. facing a grim milestone as it creeps closer to 500,000 deaths due to COVID-19. Is there hope in sight for the country? Katie Simpson will have that story coming up. The U.S. is closing in on another grim milestone, 500,000 COVID-19 deaths. As Katie Simpson reports from Washington, vaccines are providing a glimmer of hope, but many are looking back and wondering whether decisions made early on had devastating consequences.
Lineups stretched for blocks as word spread in San Francisco of a new pop-up vaccine site.
I looked online and said it's fully booked everywhere in California. So I think this is great that I can come down here.
The prospect of getting a shot serves as a glimmer of hope in this moment of darkness.
It's stunning when you look at the numbers, almost unbelievable, but it's true. This is a devastating pandemic.
Hundreds of Americans are still dying each day, the death toll surpassing the population of some major cities, including Miami. More than 1 year into this pandemic fight, we are armed with more knowledge and better resources. Yet this battle is still a long way from over.
Do you think Americans will still be wearing masks, for example, in 2022?
You know, I think it is possible that that's the case.
The reluctance to embrace masking is seen as a failure by a former member of the Trump administration. The initial resistance came at a time when there was a PPE shortage, and the Centers for Disease Control feared a surge in demand could hurt frontline workers.
Then made the mistake of conflating that with a set of advice that masks don't work effectively for the general public. That was a big mistake.
The Biden administration is now being pressed on whether there should be an investigation into the U.S. COVID response.
I believe that we need to take a variety of steps to look at the previous administration's response to the pandemic and what lessons we need to learn to make sure that never happens again.
There are signs the COVID fight is headed in a better direction. The daily new case average is now 67,000, down from 249,000 just over a month ago. And more than 63 million Americans have had at least one dose of the vaccine. Katie Simpson, CBC News, Washington.
British Prime Minister Boris Johnson set a dramatic pandemic target: vaccination available to all adults by the end of July. It comes ahead of an announcement tomorrow expected to lay out a reopening plan. CBC's Dominic Velitis reports.
This is a big story here in the UK. It has made the front pages of pretty much every single newspaper we have. To give you a bit of context, more than 17 million people have now received a jab since the UK's vaccination rollout began in December. There is evidence it is already contributing to a fall in hospital admissions. And there's also some early data now showing a reduction in transmission rates in people who have received a vaccine. The Prime Minister Boris Johnson, though, says he wants to go further and faster with the country's vaccination programme. And his pledge today that all adults in the UK will now be offered a first dose of the vaccine by the end of July shaves weeks off the government's original target of giving everyone a first jab by September. Now, it's hoped the move will allow vulnerable people to be protected sooner, which in turn will help further ease lockdown restrictions across the country. The new target will have a wider impact on the vaccination programme as a whole. For example, it now means the top 9 priority groups in the country. That's everyone from residents in care homes, the over 80s, all the way down the list to the over 50s will have been or will be offered a first dose by April 15th. What is less clear, though, is the order of priority for the under 50s, the rest of the British population, and the final group of people to be offered a jab. That hasn't yet been decided, but we are told an announcement will be made in the coming days, most likely after Boris Johnson unveils his roadmap out of lockdown tomorrow evening. Dominic Velitis, CBC News, Bristol, England.
Well, that's a live look for you tonight at Windsor. It is a calm night, but most of southern Ontario bracing for yet another storm. Coming up, we'll have your full weather forecast after the break. The ski hills were open in Timmins this beautiful winter weekend. The city is now in the orange zone of the province's COVID-19 response framework. Along with ski hills, restaurants and movie theaters have reopened, but to a limit of 50 people. Snow for the ski hills up north might be good, Sophia, but not for commuting tomorrow in the GTA.
No, it was a fantastic weekend to get out and enjoy all those outdoor winter activities, though. But yet, all good things must come to an end. -3, a little chilly overnight, but there's a change afoot. A warm-up is on the way. A warm-up along with, yes, as you mentioned it, a little bit more snow. Okay, Colorado low comes in on Monday. It's a clipper system on Tuesday, and then kind of another wave of energy with more snow and squalls for Wednesday. It's a taste of what's to come. Let's break down the timing for you for the next 24 hours first, and then we'll move on to more of the long range. The heaviest snow, as you mentioned it, for that Monday morning commute. If you are headed on the roadways, reduced visibility, you want to plan your travel accordingly to the conditions. Monday afternoon, a little bit of mixing could pop in, especially anywhere along lakeshore regions. Heavier snow still in the escarpment areas before everything clears away Monday afternoon and evening. The next system comes barreling in on Tuesday. Weather advisories are out by Environment Canada everywhere from Windsor up to Barrie and Orillia over to the Cobourg area. Niagara, you're not included in the weather advisories because it will be more of a rain event for those of you there. We are talking about an active storm track in our area, but first we have to get through this next system, about 5 to 10 centimeters, and we will be a few degrees cooler by midweek.
A lot happening this week. Thanks a lot, Sophia. And that's our show for you tonight. We're going to leave you with a few more shots of the beautiful day in Toronto. Be safe out there when it starts snowing, everyone, but have a great night.